There's an amendment at the desk, and the clerk will report the amendment.
Gruenhagen moves to amend Senate File number 972, the third engrossment, as amended. The amendment is coded A5.
To the author of the amendment, Representative Gruenhagen.
Oh, thank you, Madam Speaker and members. This is the last amendment I have, members. Some of you probably are relieved. But members, this is a very important one. Currently, we allow hydroelectricity, which is carbon-free and clean, to be part of the renewable energy standard. But we only allow it up to 100 megawatts maximum, okay? So it's small hydro. Members, we have much higher megawatts available in Canada we could tap in for up north. And by the way, hydro is cheap and plentiful. And also South Dakota, the Missouri River. So we can simply use that as a base load electricity if necessary. And here's why it's necessary, members. We had testimony in the Energy Committee, and I asked the question, you know, if we go to 100% alternative, wind and solar, what if we have a polar vortex of 30 below zero? What's going to happen? Okay? And the response from the testifier, who was pro-alternative energy, was that, well, we will simply reach out to the 5 states around us from their alternative energy to support our shortfall, okay? And I said, well, how long will that last? Well, he said, if we need the regional alternative energy, it'll last about 4 hours during a polar vortex. Now, here's the problem, members. The last polar vortex in 2019 lasted 48 hours, okay? So the response was 4 hours, and the polar vortex lasted 48. You know what that means? The electricity's going off, okay? I like electricity, all right? So members, all this does is lift the cap on the 100 megawatts of hydro, which is clean base load electricity, so that if we experience a crisis either in summer or winter with our alternative energy, that we have something to back it up so that Minnesotans don't have rolling blackouts at the worst possible time. That's all this amendment does. So if you support clean energy, which hydro is, base load energy, relatively inexpensive and reliable, you should vote green on this amendment. Even if you don't care for me, you should do it. All right? So, members, think about your constituents. Do you want California here? It seems like in Minnesota, our government worships California in so many areas, whether it's the electric cars or alternative energy or whatever it might be. And yet they're experiencing tremendous problems there. People are moving out by the droves. Do you think you're going to help grow our economy and create more jobs by not having base load electricity? You think 3M is going to want to live in a state where the electricity goes rolling out depending on the weather and the situation? I don't think so. Again, you don't even have to use this electricity unless you need it as a backup. And we've seen alternative energy fail time and again. So members, I would ask for a roll call on this, Madam Speaker.
Roll call having been requested. Seeing 15 hands, there will be a roll call. Representative Gruenhagen, and just one more reminder.
Oh, yeah.
Yep, thank you.
See
Representative
what
Gruenhagen.
happens, I start sweating up there and my ski nose, it skis off there.
Representative Gruenhagen.
You don't have a fix for that, do you, Madam Chair? No, I'm just kidding. Anyway, members, again, this is serious, okay? Think about your businesses and your constituents. Do you want them to have a backup backup base load electricity that's reliable, dependable, and inexpensive, rather than unreliable, might be non-clean, and expensive. Yeah, thank you. That's what the choice before you is. So members, I hope you can support this amendment. Thank you.
Discussion to the amendment. The member from Hennepin, Representative Katiza Watun. I believe she may have pulled back her request to speak. I'll try one more time. Representative Katiza Watun, just to make sure. Okay. Discussion to the amendment. The member from Hennepin, Representative Long.
Thank you, Madam Speaker. Sorry to disappoint you again, Representative Gruenhagen, but I'm going to have to oppose this amendment as well. This is current law, and I think was put into current law for a reason, which is that there's environmental concern with very large hydroelectric power. But the good news is that our carbon-free standard would count all hydro energy, and so hopefully you'll be supporting our carbon-free standard as well. So I'd ask members to vote no.
Further discussion to the amendment. Seeing no further discussion, the clerk will take the roll on the bill, on the amendment, excuse me, on the A5. Members voting remotely, please vote. The clerk will call the names of all those members who have not yet voted.
Bliss.
Bliss, aye.
Bliss, aye. Bow.
Bow, aye.
Bow, aye. Davney.
Daphne, no.
Davney, no. Hausman.
Hausman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Cleavorn.
Cleavorn, no.
Cleavorn, no. Lee.
Lee, no.
Lee, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Moran.
Morant, no.
Moran, no. Richardson.
Richardson, no.
Richardson, no. Thompson.
Thompson, no.
Thompson, no. Zhang-Jie.
Chongje, no.
Zhang-Jie, no.
The clerk will close the roll. There being 64 ayes and 69 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Mecklen moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A15.
The member from Sherburne, Representative Mecklen.
Thank you, Madam Speaker, and members. I'm sure Chair Long and Representative Stephenson are pretty shocked by this amendment, as I've brought it up many, many times. There's a lot of reasons for this. Number one, we have a statewide building code, and it's to uniform for those of us that actually do the building trades, number one. Number two, I think Minnesotans are better positioned to make the best decisions for themselves as to what they need to have, depending on where they live, whether it's urban, suburban, or rural. What benefits them the best to make sure that they have the ability to heat their home. And I've carried this thing or pushed this thing in committee numerous times, and I'm sure Representative Stevens has got a smile on his face right now. numerous times. And I really believe that this is the right direction to go. And I don't think it's the job of the state to tell people what they must do. And I hope I can get your support. And I would ask for a roll call.
There's a roll call being requested. Seeing 15 hands, there will be a roll call. Representative Mecklin.
Thank you, Madam Speaker. I don't know if there's going to be any pushback or whatever, but this is a really, really important thing. We saw what happened in recent times, and not only this year, but we saw it back in 2019, where there was rolling brownouts and blackouts. We've seen it in California. We've seen it in Texas. I think it's important to make sure that when we need our heat, we have our heat. It's a very important issue, and I don't think while local control often is better, in this case, I do believe that it is better to have a statewide building code and have a uniform policy in this regard. Thank you, Madam Speaker.
The member from Hennepin, Representative Long.
Thank you, Madam Speaker. Thank you, Representative Mecklin. Yes, we've discussed this a bunch in committee, and as you mentioned in your remarks, we do have a statewide building code, and that statewide building code already prohibits what you were seeking to do here. So this is already banned under current state law and not needed, and I would ask members to vote no.
Further discussion to the amendment. Seeing no further discussion, the clerk will take the roll. Members voting remotely, please vote. The clerk will call the names of those who have not yet voted.
Bo.
Bo, aye.
Bo, aye. Franzen.
Franson, yes.
Franzen, aye. Hausman.
Houseman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Keel. Keel, aye. Cleavorn.
Cleveland, no.
Cleavorn, no. Katiza Watun.
Katiza Watun, no.
Katiza Watun, no. Lee.
Lee, no.
Lee, no. Mason.
Mason, no.
Mason, no. McDonald.
Donald, aye.
McDonald, aye. Scott.
Scott, aye.
Scott, aye. Thompson.
Thompson, no.
Thompson, no. Wozlowick. Wozlowick.
The clerk will close the roll. There being 63 ayes and 69 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Igo moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A22.
The member from Itasca, Representative Igo.
Thank you, Madam Speaker and members. So this amendment would be to allow carbon capture and storage. So we're seeing that around the country, that other states are starting to lead, that there is another option for coal burning and natural gas burning power plants. We can capture that CO2 and we can store that CO2 safely, sometimes up to 100% of CO2 stored. Now, the objection that we're trying to do by working in the Climate and Energy Committee is keep energy prices affordable for all Minnesotans. I think this is a way that we can continue to keep prices low and have an all-of-the-above energy approach for all Minnesotans. Now, I don't want you to just take my word for it, but upon doing some of my research, I found that our president actually believes in this technology, stating the Biden-Harris administration wants to accelerate the development and deployment of carbon capture sequestration technology. According to the Blue-Green Alliance, carbon capture use and storage is a rapidly growing technology that has the potential to create economic benefits for multiple industries while significantly reducing carbon dioxide emissions. President Biden shares the Carbon Capture Coalition's goal to make CCUS a widely available, cost-effective, and rapidly scaled solution to reduce carbon emissions to meet mid-century climate goals. Toward this end, he will double down on federal investments and enhance tax incentives for CCUS. At the time to bring new carbon capture technologies to market, Biden will continue to fund carbon capture research, development, and demonstration. So while we see that our president is interested in doing technology like this, there's also states across our country that are doing this. It might be no surprise that states like Texas, Louisiana, Montana, and North Dakota are already implementing this, but California believes in this. And federal tax code actually already has incentives to have carbon sequestration and storage as an implemented way to reduce carbon emissions for our power plants across our country. So, and another state, and it's worth mentioning that another state, our friendly state, North Dakota, is actually in the process of building one of these power plants that's going to store 90% of its CO2 emissions. Members, that's 800,000 cars a year that'll be saved while keeping the cost of electricity low so that we have an all-of-the-above energy approach. And Madam Speaker, I'd like to request a roll call.
A roll call having been requested, seeing 15 hands, there will be a roll call. Representative Igo.
Thank you, Madam Speaker. Members, I would hope that we can encourage a green vote on this and add this to our bill today so that we can diversify our energy portfolio and keep Minnesotans with affordable electricity. Thank you.
The member from Hennepin, Representative Long.
Thank you, Madam Speaker. Thank you for the amendment, Representative Igo. So this would be exempting the carbon capture and sequestration technology from the 100% standard. And you set the goal at 80%, which means that there's 20% of emissions that will be released, which quite simply is not 100% carbon free. You also mentioned that the North Dakota plant that is being pursued is looking at a much higher standard of over 90%. So if we're going to exempt carbon capture, I don't know why we would do it at such a low percentage of 80%. So I would ask members to vote no.
Further discussion to the amendment. The member from Lyons, Representative Swedzinski.
Thank you, Madam Speaker. Thank you, members. You know, when I talk to business owners, they are very concerned about the cost impact of this bill. And Representative Igo does an excellent job of understanding when you are a large energy producer in our state, when you're and especially when you're a large energy consumer in our state, you have a lot to lose potentially from this bill. The reliability of the grid, when you're a large consumer, whether you're producing iron ore, whether you're an agriculture processor, whether you're a meat packer, whether you're a refrigerant, where you freeze food for the populace is a huge issue, even if you drive an EV. And you know, I think we just need to allow for technology. And if you ask anyone, does the technology exist to have 100%? No. The realities on the ground are we need good, solid baseload energy. An all-above energy plan is what's best for America, what's best for Minnesota. And clean carbon capture technology needs to be included in this bill, at least as a leapfrog, till other things can potentially be developed. And I would support Representative Igo's amendment because it not only stands strong for Minnesotans, but for the range as well. Amen. Please vote for the bill. Sorry.
Further discussion to the A22. Seeing no further discussion, the clerk will take the roll. Members voting remotely, please vote. The clerk will call the names of all those members who have not yet voted.
Hausman.
Hausman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Cleavorn.
Cleaborn, no.
Cleavorn, no. Lee.
Lee, no.
Lee, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Noor.
No, no.
Noor, no. Richardson.
Richardson, no.
Richardson, no. Thompson. Thompson.
The clerk will close the roll. There being 63 ayes and 69 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Macklin moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A4.
To the author of the amendment, the member from Sherburne, Representative Meckland.
Thank you, Madam Speaker. This is probably one of the most important amendments. As we push forward to all this renewable, as you talk to the folks that actually run these power plants, which I just did a little bit on the last amendment I did, there has to be a balance, and there has to be a reliability balance. This is a really, really important bill. Back in 2017, my predecessor, they got into legislation that there would be a gas plant built in Becker to replace the retiring coal plants. Gas plants are a little more reactive and quickly can follow up as wind and solar, back off or die off, if you will, depending on whether the sun is not shining and the wind is not blowing. This is incredibly important. And I find it ironic that this thing came in at the last minute to rescind this thing in this bill to replace this power plant. Many people are concerned about reliability, and I find this to be a very important thing, not only for the community. While the community is currently planning on, I believe Excel has a very large solar project, several actually, almost 10,000 acres. As they're moving forward, but at the same time, they need a backup power plan when the sun is not shining. To me, this is a very, very important thing, and I really, really hope all of you members will support this to make sure we have reliable energy going forward. And I ask for a roll call. Thank you, Madam Speaker.
A roll call having been requested. Seeing 15 hands, there will be a roll call. Further discussion to the amendment. The member from Hennepin, Representative Long.
Thank you, Madam Speaker. In the 4 years since this provision was adopted, renewable energy has continued to get cheaper and cheaper. And we hear a lot about picking winners and losers in our discussions on energy. And all this provision is designed to do is allow proposals for the facilities at Sherco to go through the regular process and not put a finger on the scale. We want to make sure that we're getting the best outcome for ratepayers, including the most affordable outcome, and that could very well be natural gas, but we want to allow the Public Utilities Commission to go through the process of making that determination, and I ask members to vote no.
Further discussion to the A4 amendment.
Madam Speaker.
Representative Mecklen.
Thank you, Madam Speaker. Being that this was passed back 4 years ago by the legislature, I believe that we are the ones, not the non-elected PUC, to be part of this conversation. And I strongly urge a green vote. Thank you, Madam Speaker.
Further discussion. Seeing no further discussion, the clerk will take the roll on the amendment. Members voting remotely, please vote. The clerk will call the names of all those members who have not yet voted.
Bo.
Oh, aye.
Bo, aye. Hausman.
Houseman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Lee.
Lee, no.
Lee, no. Mariani. Mariani. Mason.
Mason, no.
Mason, no. McDonald.
Old McDonald, yes.
McDonald, aye. Moran. Moran. Richardson.
Richardson, no.
Richardson, no. Thompson.
Thompson, no.
Thompson, no.
The clerk will close the roll. There being 63 ayes and 68 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Haley moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A27.
The member from Goodhue, Representative Haley.
Thank you, Madam Speaker and members. My amendment is to ask the Department of Commerce to do a study and a report on the disparities in the geographic rating areas in the individual insurance marketplace, and to report back to the legislature with some options on redrawing those boundaries to make the insurance rates more equitable. Very briefly, when the ACA passed in 2010, there were the following requirements around these rating areas. One, they were supposed to be actuarially justified, it's hard to say that behind a mask, not unfairly discriminatory, reflect significant differences in health insurance costs, lead to stability in rates over time, and apply uniformly to all insurers. Well, it's been over 10 years since we've had these rating areas, and I would argue that the facts state that we are seeing unfair discriminatory variances in these rates, with some regions in outstate Minnesota in particular paying 20 to 40% higher than the major metropolitan areas. In southeastern Minnesota, for example, a family of four can pay a $3,000 a month premium and up to a $7,000 to $10,000 deductible. So they can be paying $30,000 to $40,000 a year for their individual insurance. And that's frankly before even really using medical care. So it's time that we have some additional information from the Department of Commerce, because if we were to make any changes in this structure, that would require a federal waiver. And in order to apply for the federal waiver, you have to have the data. So that's all that I'm asking for. Members, I would appreciate your support of this amendment. Thank you, Madam Speaker.
Discussion to the amendment. The member from Anoka, Representative Stephenson.
Thank you, Madam Speaker, and thank you, Representative Haley, for offering this amendment. Your work on this issue has been just tremendous. Really appreciate it. We had a great hearing on this proposal in the Commerce Committee that I thought inspired a really great discussion, and I think it's an important question, and we should have this study. So I would ask members to support the Haley amendment.
Further discussion to the amendment. Seeing no further discussion, all those in favor, please say aye. All those opposed, please say no. The motion prevails and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
O'Driscoll moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A25.
To the member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. What the A25 amendment does is it allows us as Minnesotans to take the fifth and final year of the federal waiver to allow us to continue our very, very successful reinsurance program here in the state of Minnesota. Minnesotans in the individual insurance market have been able to experience stability and predictability in their health insurance, which is a very big item for all Minnesotans, including the members of the legislature who have been working diligently to try to be able to resolve this issue. This has been such a popular item And I don't want to start that again. I don't want to make it sound like I'm trying to do a stand-up act here, but if I were to say to you, what do Congresswoman Angie Craig, and Congressman Tom Emmer have in common with one another? That would catch a lot of people's attention. So maybe you heard those two names, and let me just say it one more time. What do Congresswoman Angie Craig and Congressman Tom Emmer have in common? They both support reinsurance. As a matter of fact, when the reinsurance program was passed by the Republican-controlled legislature 4 or 5 years ago, Senator Klobuchar was all over the news talking about the wonderful things that Minnesota was doing. And it comes to find out that all 10 of our congressional delegation to Congress, our 2 senators and our 8 representatives, all agree on one thing. Reinsurance is a very good program. They're working in Washington right now to see if they can't escalate to a national level what we're doing here in Minnesota. And folks, I want to give you the opportunity today to be able to be a part of that strong bipartisan move that's happening here in Minnesota. I don't know about you, but in my district, I hear that legislature, Congress can't get along, but sure sounds like Minnesotans are able to get along with this. So I ask today for your support on the 825 amendment and to continue that last year on our federal waiver for the reinsurance program. Thank you, Madam Speaker, and I'd like a roll call if I could, please.
A roll call having been requested, seeing 15 hands, there will be a roll call. Further discussion, the member from Anoka, Representative Stephenson.
Well, thank you, Madam Speaker, and I'm going to ask members to oppose this amendment, and that might surprise some people because I have been a supporter of reinsurance in the past. I co-authored the bill last biennium, and I'm carrying the bill this year. Reinsurance, did what it was supposed to do initially. It stabilized the market. But I think that one of the things you got to do in this job is be willing to respond to new facts and new situations, and be willing to not be stuck in your ways. And one of the things that I know has happened this year is that we have federal action, the American Recovery Plan, that includes a provision, keep making sure that individual rates are at 8.5% of income. I'm not sure it makes sense for us to devote state resources to reinsurance, significant state resources to reinsurance, given that federal action. So I don't think it's appropriate for us to adopt this amendment at this time. I'd also just like to note that we had a great hearing on this in the Commerce Committee where we talked about a number of reform proposals that were brought to the table that I thought made the reinsurance program stronger, and those unfortunately weren't included in Representative Driscoll's amendment here. So I would ask the chamber to vote no on this amendment.
Further discussion, the member from Sibley, Representative Gruenhagen.
Oh, thank you, Madam Speaker. Yeah, thank you, Chair Stephenson, for chief authoring the reinsurance bill. I am a co-author on that also. Appreciate you bringing that forward. I understand the 8.5%, okay? But the combination of the reinsurance, which I'll ask you to yield a little bit, and that 8.5%, we might actually see individual premiums decline in the state and group health insurance. Ever since Obamacare has been passed with all its promises of lower premiums and better access, the opposite has just happened. I mean, there are people, it's a burden for their family. They're going without health insurance, or they're taking such high deductibles that they're not getting the health care they need. And you say, was that just your opinion, Representative Gruenhagen? Well, a couple years ago, we had a presentation in the HHS committee, Chair Liebling's committee, and the presenter showed a study of 2017 here in Minnesota, which is, way past when Obamacare. And according to that study, and I'm doing this from memory, 1.7 million Minnesotans did not access the health care they needed. Not that they wanted, but that they needed because of high premiums and skyrocketing deductibles. Then you also have the Minnesota Hospitalization Association. With these high deductibles, they're not having people pay them. So they're losing a lot of money. It's stressing our hospital association. So I think the combination of this 8.5%, which I'm glad the federal government has taken some action, and the reinsurance, we might actually see premiums both in our group and our individual, which Again, those premiums stress our schools, they stress our counties, they stress our cities, and they certainly stress the private sector. In fact, some companies have opted not to provide health insurance because of them. So that's why I just think it's imperative that we move forward with this. And again, you were the chief author, and I would ask you to reconsider, and actually we might see premiums come down. The second thing, Blue Cross authored a study a couple of years ago. In fact, Chair Davids has referenced it in the past. And their study said that if we get rid of reinsurance, private health insurance premiums in the state of Minnesota would go up by 50%. So, you know, it's kind of like a bird in the hand is worth two in the bush. I'd rather go with something, reinsurance, that we know works versus the promise of the 8.5%, which might help some families and might help others. We did the reinsurance because the private market was ready to collapse. The private health insurance market was ready to collapse in the state of Minnesota. So I would ask you to reconsider that, the body in general, and we could actually maybe see premiums and deductibles come down somewhat. And Madam Speaker, if Chair Stephenson would yield for a question.
He will yield. Representative Gruenhagen.
Okay, thank you, Madam Chair and Madam Speaker and Chair Stephenson. What percentage will be paid by the federal government if we would renew this reinsurance? That's the question.
Representative Stephenson.
Well, thank you, Madam Speaker, and Representative Gruenhagen. You know, we have about $150 million in the Premium Security Account Fund, and it would take all of that. The amount that the federal government gives us for reinsurance on the pass-through has varied year to year, and we don't actually know what it would be for that fifth year. We wouldn't know that until after we reauthorized it. But in recent years, it's been, you know, less than 90 million, sometimes a little less than 80 million. So, you know, there's a reason why I became a lawyer instead of an accountant. I'm not quick on math on my feet, but if you want to do the percentage there, that's what it would work out to.
Representative Gruenhagen.
Oh, thank you, Madam Speaker. Thank you, Chair Stephenson, for that response. Yeah, I think it's close to 80 to 90% in the past. Now, I don't know if that's going to change. I do remember the Minnesota Health Plan's lobbyist gave us a presentation a year or two ago, and it showed that the federal government was going to pay a majority of this, and that if we went away from reinsurance, we would lose that, or it would be transferred to a different program. Members, the private market health insurance is suffering. The combination of the 8.5% plus reinsurance might actually see rates stay stable or come down. That's what my hope would be. So I hope we would vote for Representative O'Driscoll's amendment and give some relief, especially to both our local governments, schools, and the private sector. Thank you, Madam Speaker.
Further discussion, the member from Fillmore, Representative Davids.
Thank you, Madam Speaker and members. I rise in support of the O'Driscoll amendment. This was an interesting one to work on. I was the chief author of the original reinsurance bill, and to take us back in time just a bit, the private market was collapsing, and this not only saved the private market, but it brought additional carriers in. We had areas of the state that had basically no companies in the private market. So it worked, is wildly successful. I have appreciated the support of Senator Klobuchar, Senator Smith. The entire congressional delegation realizes how important this is, and other states have taken our model and have been doing the same thing. And as someone mentioned earlier, we're looking at going nationwide with this. So I think it would be unfortunate not to put this forward, keep this in the debate. We know, members, that this will end up in a final bill someplace, somewhere. I think it was 2 years ago it ended up in the Health and Human Services bill. My good friend, the chair of the committee from Olmsted, had to carry a bill with something I know she didn't like too much, but it's that necessary. This will end up in the final mix. We're going to do this. Let's not take a negative vote on this House floor today. I want to thank Chair Stephenson for taking up the mantle and carrying the bill. But we can have our cake and eat it too here if we move forward. I understand the federal provisions, I get that. But we need to continue the looking at the reinsurance part of it as part of the mix in the final bills that will be coming through in less than a month. Thank you, Madam Speaker and members.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker, and members. Representative O'Driscoll, thanks for bringing this forward as an amendment. I think it deserves to have a healthy debate on the floor today. I am opposed to this provision because reinsurance does absolutely nothing to lower the cost of health care. All reinsurance does is take the health insurance cost, which is not health care. It takes the health insurance cost and lowers the premiums for a very small percentage of Minnesotans, people in the private market, and socializes it across all taxpayers. It takes taxpayer money to help pay down the insurance premiums by shifting a burden of the insurance company's responsibility of actually insuring people, shifts that onto the government, which we call socialism. So this program, while successful in lowering the cost of the premiums, was done so because they just shifted onto the taxpayers. It's not a surprise that it worked. The program was a Band-Aid that was put in place to lower premiums because the premiums were skyrocketing, not because the insurance premiums, the insurance companies were making, hand over fist money, profits. It's because the cost of care went up. The only way you can lower the cost of care is to address directly what the costs are, to bring in more competition, to allow people to shop for care, to bring price transparency into the market so people can actually understand what the costs are instead of getting a bill a month or 2 months later. That's how we address the cost of health. That's how we lower the cost of health care. And through lowering the cost of health care, you will lower insurance premiums. That's what's so important. This bill, this provision for reinsurance doesn't do that. Again, it takes all taxpayer money and applies it to the premiums of a very small percentage of Minnesotans that are insured in the private market. And the insurance deductibles have been skyrocketing. People have over $10,000 insurance deductibles. And this health insurance premium simply says that the state of Minnesota, all the taxpayers are going to cover the costs of a large portion of the costs, over $50,000 to $250,000. This is not the right approach. I'm embarrassed that Republicans support socialism in this manner. And you're right, it is supported broadly by Democrats in Washington, D.C., because they see this as a way for socializing healthcare. And the insurance companies love it because they don't have to do their job and actually insuring people. They can just shove that risk onto the taxpayers. So I'm absolutely opposed to reinsurance. It was a necessary Band-Aid while we tried to address the cost of care and lowering those costs. But this should not have been extended last time, and it certainly should not be extended this time. So members, Madam Speaker, thank you.
The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. Since my name's been invoked a couple of times in this debate, I thought I would just add a little bit more about why members should oppose this amendment. And interestingly, I find myself largely in agreement with what Representative Munson has just stated. He stated part of the argument very well. I don't think it's socialism, but it is socializing the cost of insurance, spreading it across taxpayers, as he mentioned. Of course, we do that a lot in healthcare, but there are a couple of additional reasons why I think that reinsurance is a bad policy. And for people who may be listening to this, that may not even know what this is where the state of Minnesota pays for a chunk of the costs that insurance companies incur paying for high healthcare costs for people that they are covering. So naturally, when somebody else is paying a big chunk of the cost of the care, they can lower their premiums. But there are other problems with this policy as well. One is that it's not transparent. Even though it's great that insurance premiums have been held down somewhat, there's no guarantee that that continues to happen at all. There is no real guarantee about how this money gets used. So we don't know that. Secondly, it is not targeted by the need of the person buying the insurance. It's just a general policy to hold down premiums in the individual market. So whether you are wealthy or just poor enough to be able to have to buy in the individual market without help, this is not targeted. It's holding down premiums the same for everybody. And finally, and this is something that Representative Stephenson did mention, that it's just not necessary now because the American Rescue Plan, at least for a period of time, is going to hold down premiums for everybody buying in this market who's buying through MNsure, just the way it does right now for people under 400% of the federal poverty guidelines. It's going to do that for everybody buying in the individual market through MNsure. So this is going to mean that nobody who is buying in that market is going to be paying more than 8.5% of their income for insurance premiums. Now, is this a total fix? No, it doesn't do anything for out-of-pockets. We still have problems. And as Representative Munson mentions, it doesn't do anything for the cost of health care. But it's a better policy than the one that's being pushed here. So I would urge members to vote no on reinsurance.
The member from Hennepin, Representative Hertaus.
Well, thank you, Madam Speaker. And what a discussion of the dog chasing the wag, if you will, or the tail chasing the wag. You know, if this was truly a free market system, there would be no such thing as insurance. Everybody would just simply have to look to their own treasure to pony up and pay for the medical service that they have. If that's what free market is, that's what a free market would be. But the very term insurance is socializing and spreading the cost across the greater good of all those who are consumers. Let's get to the real core of the problem. This has been going on for 40 years or more since Medicare. And Medicare is a wonderful program in many regards. And it is something that is an entitlement that nobody's going to let go of. But nonetheless, there's been greatly overpromised services under Medicare without the ability to adjust with regard to the actuaries, knowing that lifespans were going to increase, that medical services were going to, new technologies were going to offer life-saving technologies and treatments that people clearly want to have. And we have a pro-life movement that we want to certainly make our lives last as long as possible. And I support those things. But the truth of the matter is, insurance by itself is socializing health care. Just the word insurance means that. Medicare has been cost shifting for the last 4 decades, the increased costs that insurers have had no choice but to outrageously adjust prices in the private sector to cover the uncovered expenses that Medicare does not pay. This is the beginning of the culprit, of the unwinding of our healthcare system. And so to that end, if you don't reinsure, you will get rid of all of the private insurers that there are. You will certainly restrict or limit the number of them, and the rates will continue to climb. And so then you will not have private insurance or access and choice as we used to know it. It's a dwindling market and it's on life support. And for those reasons, I do support reinsurance because the alternative is single payer. And if you're worried about the cost of healthcare as a society, let the government run the whole thing. Then you'll know what the real cost is. It won't be affordable in any form. And the services you want won't be available to you because you're too old to get it. And we already know this happens around the rest of the world. If you're 90 years old, you're not getting a knee replacement in many countries. So that's the end of that. The problem goes back to socialization of medicine and our healthcare system going back more than 50 years ago. Thank you, Madam Speaker.
The member from Isanti, the Minority Leader Doubt.
Thank you, Madam Speaker and members. Just listening to the debate, it's probably wise that we have a little history lesson on how we got here. I, for one, wish that we didn't have to do reinsurance, but I think people in the chamber here forget what a colossal failure Obamacare has been for these people. And when I say, I wish I could use a word that would emphasize even more how disastrous Obamacare has been for Minnesota. It really has been. I know people like to say, but there's so many more people insured. If you call a $10,000 or $13,000 deductible insured, then technically, yes, you could say that. But these people are not insured. That is not insurance. You're not covering their healthcare costs. I remember, a few years ago, touring around the state and talking to people about this issue, running into families of 4 who were paying $3,000 a month or more, $3,500 a month for their insurance in the individual marketplace. And on top of that, they had a $13,000 deductible. I mean, you're talking about $50,000 out of pocket for a family of 4 before they had 1 penny of coverage. That is not health insurance. These people are not insured. And that's what Obamacare did for Minnesota families. It was a colossal failure, period. That's indisputable. And if you don't believe me and you want to know, I'll bring you and sit you down at a table with those families that I talked to. That's not in dispute, okay? So then we have this individual marketplace with these sorts of rates. And people were fleeing the marketplace because they couldn't afford the product. And they were making a decision to either go uninsured or to enter into some sort of a cost-sharing program. We saw many people do that. But we were promised that there were going to be so many people in this individual marketplace, and that was going to keep the cost down. And it just didn't work. It was a failure. Obamacare was and is a failure, period. So what we saw year after year in the individual marketplace in Minnesota is whoever would be the lowest bidder, whichever provider that would, and they each had to bid, they each submit a bid, and you could see their rates, and then people in the marketplace could choose to buy the product from one of those companies. Whoever had the lowest bid, and this went on for 3 or 4 years, I think, whoever had the lowest bid, the next year exited the marketplace every single time. They were bidding to be competitive. They would get all the high-risk people that would go onto their product. They'd lose their tails, and then they would stop the next year offering the product. And we got to the point where the individual marketplace was hemorrhaging not only customers, but insurance providers. And many parts of the state only had one product. So there was no choice in the marketplace. So what we said is, okay, we got to stop the bleeding here. Because the ultimate end result was going to be there was going to be no individual marketplace. Now, I know that there's a lot of supporters of single payer in this chamber, including Representative Munson, apparently. But that's the result. If we don't have an individual marketplace, the only thing that happens then is we have to put in place a single payer system. I know Democrats call that a public option, but what is the option when there's no choice? It's not an option. We call that single payer. I always love the argument about reverse engineering. And people say, well, that wasn't the idea. We're not trying to destroy the individual marketplace. And I think to myself, just look at the evidence. I won't question the motives, but let's just look at the evidence. Because if you wanted to destroy the individual marketplace, I couldn't have written a better bill than Obamacare. And unfortunately, you know, people talk about how many people are insured and how successful that was. It was not successful at all, period. Every single person that I know has a higher deductible today by multiple times than they did before Obamacare. And rates have skyrocketed. And we saw people leaving the individual marketplace. So what did we do? We said we got to stop the bleeding. We put in place this reinsurance program, and we said this will stabilize the market. We're going to put some public money in, and we're going to ensure that the insurers don't have a risk above a certain level. So their losses can't exceed a certain amount. And what did it do? Rates immediately stabilized and since have been coming down. And we automatically saw people return to the, insurers return to the marketplace. So now customers have choices. I think it's been a while since on the House floor we've actually heard what happens and what the results are of competition. Competition is a very good thing. What happens when you have competition? Prices come down and quality goes up. Those are the two natural forces of competition. A single payer system, prices will go up and quality will go down. I don't support that. I'm not a proponent of single payer. And until we can actually roll up our sleeves and do the work required to reform the cost of health care in this state and provide the incentives necessary to get people interested in managing their own health care so they have some ownership in it, we're not going to control those costs. But thus far, I haven't seen the courage in this chamber to actually do that. If you show that courage, I will support it. But the reforms that I have seen, and I'm only talking from my perspective of reverse engineering, I look at the evidence before me, and that's how I make a decision on what I think you're trying to do. And it's very obvious to me that Democrats in Washington, D.C., and Democrats here in this chamber want a single-payer healthcare system with no private insurers in the marketplace. And the reason I say that is because when I look at what you have done and what you support, I couldn't design a better system myself to get us to a single-payer system. So thank you for bringing this amendment forward. On this amendment, you either support saving a private marketplace and giving us the options and the time to reform the cost of healthcare so that we can fix the system long-term, or you support single-payer. That's what this vote is about. And there isn't a third option. Because if you don't put reinsurance back in place for another year or two, we'll continue to see what we know the history has been. Insurance providers will leave the marketplace, rates will increase, and we will fail after a certain amount of time. We will fail to have an individual marketplace, and consumers in Minnesota will lose their health insurance and they will have no choice whatsoever. And the only remaining option will be a public single-payer healthcare system. We put money into this at the beginning, and we have not had to fund this since. And the money that's there, there's no appropriation in this amendment. There's not one necessary. And I assure you, at the end of this legislative session, you will vote for this. Go ahead and vote against it today, but at the end of the session, you're going to vote for this. Why? Because it works. It has been successful. Its cost was much lower than we ever thought it was even going to be. But it stabilized the marketplace. It kept insurers in the marketplace. It ensured that your constituents would have the choice they need to make the right choice for their own healthcare decisions. And we have not had to put more money into it since day one. And the money that's still there will fund it going forward. So since we know we're going to do this at the end of the day, why don't we just do it today? Put up a green vote and let's do the right thing.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker. A few things I need to respond to. Representative Hertas described insurance as being socialism. And, you know, the whole reason why you have insurance isn't because you want to socialize your losses. It's because people don't have perhaps the financial means to pay for a major car repair during a collision or a catastrophic health cost. And so we enter into a private agreement with a company that administers a fund that we all pay into to get it back. This doesn't involve government, but it's collectively pooling our resources in a private contract. And we are responsible for paying for that. There isn't taxpayer money that comes into this pool that pays it for out of everybody else. And if you want to pay your own way, you should be allowed to and not have to pay for other people's expenses in these funds. That's a primary difference. I've worked for reinsurance companies. I understand the product of insurance companies buying insurance on their product because they themselves don't want to have this enormous risk. Whoops. And sorry. 1 second. And I need to respond to Representative Dowd as well. I don't support single payer. Representative Dowd has described the reinsurance program, which is socialism in the slow lane. That's what we've had. And in leadership had the ability to address the cost of the underlying cost of care through major reforms, but those weren't addressed. We've not done that. We haven't brought a significant amount of price transparency. We haven't supported a bill like the Right to Shop Act, which allows patients to actually see full price transparency on all goods and services and actually shop for care. The big winners in this program that believe that Obamacare was wildly successful were the pharmaceutical industries, because they were untouched by Obamacare. That was the agreement right away when Obamacare was brought forward. As long as you don't try to lower the cost of prescription drugs, which makes up an enormous cost of care, and why these insurance rates have skyrocketed. Between that and pharmacy benefit managers have caused the cost of pharmaceuticals to increase. That's not being addressed, and that could be addressed through our legislature. The insurance companies make money by two ways. They mark up the cost of care. They actually get a percentage of all of the billables. And so they have an incentive to increase the cost of care and to ignore the pricing and to prevent their customers or the patients from actually seeing the pricing. There's an incentive for the prices to go up because they make more money. And then they also make money by administering stuff. So even with single payer or socialism, the government is going to still pay these private insurance companies to administer their plans. And they make a fortune on those plans because they don't even have to carry the risk on a lot of them. The frustration that I have with how we've not been addressing this is because of the lobbyists and special interest groups for these industries and their stranglehold. We even have a member of this chamber who works for a DC lobbying firm that represents pharmaceutical companies. How are we supposed to bring forward reforms when we have lobbyists that are entrenched in our own body? This is going to prevent us from actually addressing the real underlying cost of care. And that will, if we can lower the cost of care, we can lower the cost of insurance. But injecting taxpayer dollars into this program through reinsurance, just dumping money into the back door of these companies, is not going to lower the cost of care. It's just going to subsidize it and socialize it. This is socialism in the slow lane, and we should not be supporting reinsurance. We need to address the underlying cost of care. Thank you, Madam Speaker.
To the author of the amendment, the member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. Just very quickly, thank you for your time for the robust discussion that we've had on the amendment. Remember that reinsurance is not a new concept. It might be newer in the health insurance area, but it has been used in the life insurance industry very successfully. It has been used in the property casualty area very successfully. And if you ask your insurance company, you may find out that they're actually participating in a reinsurance program to reinsure your automobile, your home, your business, because smaller companies sometimes need a formula like reinsurance to help them with those catastrophic losses. And as been pointed out today, that's the purpose of insurance. So again, Madam Speaker, I know we have a roll call on this. Let's go ahead to the vote. Thank you so much for your time, member.
Seeing no further discussion, the clerk will take the roll. Members voting remotely, please vote.
Will the chief clerk please call the names of those members who have not voted yet?
Bo.
Bo, aye.
Bo, aye. Garofalo.
Garofalo, yes.
Garofalo, aye. Hausman.
Houseman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Lee.
Lee, no.
Lee, no. Mariani.
Mariani, no.
Mariani, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Olson, B. Olson, B, aye. Thompson.
Thompson, no.
Thompson, no. Zhang T.
Zhang Chi, no.
Zhang T, no.
The clerk will close the roll. There being 56 ayes and 76 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Jurgens moves to amend Senate File Number 972, the third engrossment is amended. The amendment is coded A51.
The member from Washington, Representative Jurgens.
Thank you, Madam Speaker. Let's change topics here at, what is it, almost 3.5 hours into this. The A51 amendment adds criminal penalties for possession of illegally obtained catalytic converters. We can address the increase in catalytic converter thefts in many different ways. We can prevent the thefts by marking catalytic converters with vehicle identification numbers or other identifying information so thieves will think twice about stealing it. This pilot program language is in the underlying bill. We can put guidelines in place requiring certain steps by the metal recycling centers to help cut down on the market for stolen catalytic converters. If thieves can't sell them, maybe they'll stop stealing them. St. Paul passed an ordinance limiting the purchase of catalytic converters, but that didn't stop the thefts. It just moved the thieves to sell it elsewhere. Recycling centers in Minnesota are already doing a pretty good job with this. Many of the stolen cats are being collected and trucked to another state that has fewer requirements than Minnesota. This amendment adds another step to help law enforcement by making it a crime to possess an illegally obtained catalytic converter. I asked law enforcement how they catch catalytic converter thieves, and they said the best way is just dumb luck, to happen to roll up as the theft is taking place. And since the thefts take no longer than 2 minutes or even 1 minute, catching the thief in the act is not very likely. I've heard from law enforcement that they can pull someone over at 2 o'clock in the morning for speeding or stop sign violation, find 10 catalytic converters, a Sawzall, and a floor jack in the vehicle, and there's nothing they can do to them. With this amendment, someone in possession of catalytic converters would just need to show they were legally obtained. This amendment also requires law enforcement agencies to develop a process and documentation to certify ownership. If I have in my possession a catalytic converter for a 2015 Prius,
I'll need to show a vehicle title or proof of insurance for a 2015 Prius. Members, I think we can work together to find agreement on criminal penalties for possessing illegally obtained catalytic converters. But I realize this amendment will likely be ruled out of order. So, Madam Speaker, I withdraw the 851 amendment.
Representative Jurgens withdraws the amendment. There's an amendment at the desk. The clerk will report the amendment.
Frankie moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A26.
The member from Washington, Representative Frankie. To the A26 amendment, Representative Frankie. There is an amendment at the desk. The clerk will report the amendment.
Moves to amend Senate File Number 972, the third engrossment as amended. Amendment is coded A45.
Representative Jurgens. To the A45.
Thank you, Madam Speaker. Wasn't expecting to go in this order. What this amendment does is it's a housekeeping measure that brings conformity to posting for both paper and electronic poll tabs. This will help bring more transparency to electronic poll tabs and increase the integrity and confidence of the players. If most of us have been in establishments that have paper poll tabs and you see the boxes with the paper poll tabs in there, and as prizes are awarded, they're crossed off so that the players have an idea by looking at the box how many tickets are left and how many of the big winners are still in there. What this amendment does is it offers something similar for the electronic poll tab, so that as the winners are awarded, those that are playing the game will have a better understanding of what their chances are for the prizes that are left in the electronic box, so to speak. I urge a yes vote.
Discussion to the Jurgens amendment. Representative Stephenson.
Well, thank you, Madam Speaker, Representative Jurgens, for bringing forward this amendment. I would ask members to vote no. It's an interesting idea. I think it should be a bill on its own regard that we could have a chance to take a look at in the Commerce Committee, but I don't think it's an appropriate thing to have at this time without having looked at it in the Commerce Committee, and I would ask members to vote no.
Any further discussion to the Jurgens A45? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. Members, on the voice vote, when I ask for the yeses, if you can quickly say yes, and then we'll switch to the noes, and if you can quickly say no. It's when you blend them together, makes it a little bit harder to differentiate. There's an amendment at the desk. The clerk will report the amendment.
Frankie moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A26.
Representative Frankie.
Thank you, Madam Speaker. Thank you, members. The A26 would remove the language from House File 2366 that has to deal with e-poll tabs. Now, I guess I'll start off, Madam Speaker. I'd like to request a roll call on this.
Representative Frankie requests a roll call. Seeing 15 hands, there will be a roll call. Representative Frankie.
Thank you, Madam Speaker. Thank you, members. And I just want to acknowledge at the beginning of this that I don't request a roll call because I think this is a gotcha vote for the other side. Because I know members, and I concede the fact that in this provision and with my proposal, I have members on my own side that are on either side of the fence of this situation. So I just want all the charities and small businesses out there across the state to know who's willing to give them a voice in this process. Let me see where to begin. You know, after yesterday and gaveling out, and for good reason, I kind of lost my train of thought on all this because there is so much here, members, that we are not acknowledging. And this isn't whether this proposal is right or wrong or where you stand on upholding our word as a body or not. Once again, I will reiterate, this is about giving a voice to our small charities across the state and giving a voice to our small businesses across the state. Once again, at a time where they are all struggling. Now, I'll start with, let's just list off some of the charities that are going to be affected by this provision. I don't know if you've received it yet, but as we all know, these electronic pull tabs help to provide services and revenue to all of our charities and small businesses. You know, going through just the first 6 pages of what I sent out to all of you members, and members, I will say that what I sent out to all of you today, that where it lists over somewhere roughly around 1,400 small business partners and somewhere between 400 and 500 charities members that provide services right back directly into all of our communities. That list and those figures are just for 1 month, members. 1 month. That was for the month of March. So when you're thinking about this and you see those numbers, please realize the impact that we could potentially have on our charities and small businesses. Our American Legions, our VFWs. Speaking of our American Legions and VFWs, I hope you have all received this. I have a letter here from the American Legion supporting my position. I'm just going to read it briefly. State lawmakers, the American Legion urges you to have patience. Patience, members. No one desires a fight among the parties involved in gambling across the state of Minnesota. We all want what is best for each other. All parties are willing to sit down and hammer out a sound agreement, much like what was done in 2012. You have the letter. I'll skip this one. Please read it. That's from the adjutant of the American Legions. The MLBA, not sure if you got this one, but I will make sure to get it to you if you haven't. Dear members, the MLBA strongly opposes House File 2366, which substantially and unnecessarily changes all forms of electronic pull gaming and pull tabs and e-linked bingo. This bill would reduce player entertainment and reduce revenue for bars, restaurants, and local charities. The current games offered will be illegal and changed to look substantially different. Playability will no longer be engaged nor appealing, affecting patronage in our establishments. Revenue will be lost. This past year has decimated the hospitality industry. This bill is another blow to possible revenue and bringing in our needed customers. Furthermore, people like e-pull tabs. And if you've played them, I'm sure you like them too, members. That's the MLBA. Hospitality Minnesota. No industry has been hit harder financially than the hospitality industry over the last year. And I'm sure we can all concede that. Another highlight here, Electronic pull tabs have helped generate needed revenue for some restaurants and bars during this electronic crisis. We are also concerned about the timing of this proposal and the speed at which it has been considered. Now, I just want to speak to that a little bit, members. This bill came down after deadlines and then was shoved in the Omnibus. We all know what that means, members around here. That means we don't want to talk about it. We don't want to give people a voice. Let's go back to this, members, the list that I sent out to all of you. In this list, we have fire departments. Once again, all of our VFWs. There were some organizations in here that I didn't even know what they did, so I'm going to tell you about some of these organizations, members, as soon as I can find the paperwork. Because sometimes we forget about these organizations. Once again, my local Legion and my local VFW, all the money that they make helps to keep them substantially financially viable, and the gaming money goes right back into the community, right back to our veterans. But here we have one. I'm not sure if you know about an organization called the Aliveness Project. I do, because I worked with them to pass a strategic plan to end the spread of HIV and AIDS. That's what they do. They help to prevent and protect people and test people from the tragedy of contracting HIV. Another one, Climb Theater. Climb Theater has several sites throughout Minnesota, members, in all of your districts. Let me tell you a little bit about Climb Theater. Climb Theater creates customized plays, classes, and workshops that build accountability, resiliency, empathy, advocacy, and self-control. Annually, Climb inspires more than 150,000 people to make the world a better place. Should this go through and we not send it back to have a serious, wholehearted discussion on this legislation, members, places like Climb Theater are going to be impacted. Here's another really good one, members, because I saw their name all throughout this list. They're all throughout, especially the Twin Cities. I had to look them up, and I was quite impressed that they would use this funding mechanism to do what they do. Merrick Inc. Merrick Inc. has been providing day services to adults with intellectual and developmental disabilities in Ramsey County since 1964. We offer a mix of life enrichment, employment, and adult day services to more than 375 clients. Merrick is the largest day program in Ramsey County with a 56-year history of leadership in person-centered planning, self-advocacy, meaningful work options, operational excellence, and continuous innovation. Should we push this through and rush this, members? Places like Merrick Inc. that do great work like this all across Ramsey County will be impacted. Here's another little one. Mantorville Restoration Association. I wasn't sure what they did, and I'm not even sure whose district it, but the name kind of caught my eye. They just have a preservation and maintenance and education about 6 of their historic properties in the city of Mantorville, and whoever represents them, I'm sure that you're going to hear from them. I was wondering if Representative Tice would yield for a question.
She will yield. Representative Frankie.
Thank you, Madam Speaker. Thank you, Representative Tice. Representative Tice, I was just wondering if you had heard from some of your nonprofit organizations that may be impacted with this legislation.
Representative Tice.
Thank you, Madam Speaker. And yes, I have. I've heard from quite a few of them. And I'm also on the Commerce Committee, and I have to say that I was really disappointed in the way this bill came forward. We were told it was going to be an informational, which I think we needed. I think we needed more time to really hear what was going on, because my take from it so far is that the state of Minnesota is reneging on what they had told folks when this originally started. And I think the gaming board failed to take care of what they were supposed to do. I'm really sad now that a lot of our places are feeling this anxiety about what's going on, because I have heard from a lot of them. And when I look at this sheet and I look at all the places in my area that have these in their areas, in their bars, I know that this is causing great anxiety, because when we look at what our bars and restaurants are doing, we know that they're projected to lose, just the hospitality industry, lose about $11 billion in sales. So are they excited about it? You bet they are. But I also want to talk about and I think Representative Franke did a great job in saying that. Look at all the things that are funded. And I was actually quite surprised at all the things that are funded in the St. Cloud area. A lot of them are the sports. A lot of them are firefighter. A lot of them are Lions. A lot of them are the Optimist Club. A lot of them are, and the list goes on and on and on. And I could say so much more. But I really think that we needed more time to talk about this, to learn about what happened. I do think there was a failure on the part of not making sure that what was going on, progressing through the years, was not supposed to happen. And I'm really sad that we're at this point now where we have to look at that. Thank you for allowing me to say something, Representative Franke, and thank you, Madam Speaker.
Members, I just want to repeat the protocol with regard to COVID-19. Members who cannot properly wear masks that cover their nose and their mouth can participate from their offices remotely. I know it's difficult to find masks that fit properly, but we do have members in the chamber who have not been able to obtain full vaccination. So please, as a courtesy to your fellow members, wear your mask properly or find a different place to participate. Representative Franke.
Thank you, Madam Speaker. And I actually brought a different mask today because I noticed when I spoke yesterday, it kept falling down. So thank you to the city of Cottage Grove for providing me with this nice tight-fitting Geiger. Well, thank you, Representative Tice. Madam Speaker, I was wondering if Representative Walgamot would yield for a question.
He will yield. Representative Franke.
Thank you, Madam Speaker. Representative Walgamot, have you spoken also to your organizations or heard from them up in the St. Cloud area?
Representative Walgamot.
I speak with a lot of organizations in the St. Cloud area.
Representative Franke.
Thank you, Madam Speaker. Thank you, Representative Walgamot, for that non-answer, but I appreciate it. And I didn't mean to pick on you, but I kind of did, because in the St. Cloud area, members, out of the top 10, and I didn't go through this whole list, because if you go through it, there's a lot of money flowing through our charities, and our charities are going to be hurt. But out of the top 10, 4 of the top 10 grossing ETAB pull tab sites are in Representative Tice and Representative Walgamot's district up in St. Cloud. They really love to support their charitable organizations. Madam Speaker, I was wondering if Chair Pulowski would yield for a question.
Representative Pulowski, would you yield to a question? Representative Franke.
Thank you, Madam Speaker. I'll go on. Representative, will Chair Marquardt yield for a question?
Representative Marquardt, will you yield to a question?
Yes, Madam Speaker.
He will. Representative Franke.
Thank you, Madam Speaker. Thank you, Chair Marquardt. Chair Marquardt, and I hate to be calling out certain people, but there's kind of a method to this madness. Have you heard from your nonprofit organizations funded through this mechanism up in your area?
Representative Marquardt.
Madam Speaker and Representative Franke, I have received some emails, absolutely. And I do think it's important. I remember back in 2012 when the Viking stadium bill was passed. It was very controversial. And I ended up supporting that, but I remember the big part of it was the e-pull tabs, because this was going to be the new way to fund the Viking stadium. Then when that was met, it would go into a reserve and so forth. And I remember it was to be e-pull tabs and nothing more than that. And that was the concern. And so I know that was a big deal made back in 2012. And this was no small minor project. It was very controversial. And not only the stadium at the time, but the funding source. And so I think it is something we certainly need to look at, make sure that what we're doing is meeting that agreement, because I do think there is a lot to be said about agreements made and agreements kept.
Representative Frankie.
Thank you, Chair Marquardt, for answering my question. I really do appreciate that. And I didn't mean to single you out. I mean, I guess I did, and only because there, and just to point this out, from my Park High School math, Representative Marquardt has 13 charitable organizations that will be impacted in his district and over 30 small business partners. Members, this is all throughout this. I mean, I could keep going. I sent you the list of how it's going to affect your district. And once again, remember, this is not only the small business partners, it's the charities, members. And that money goes right back into your own communities, right back into the people that help support these organizations to help their neighbors. I wonder if Chair Marquardt would yield for another question.
Representative Marquardt, will you yield again?
Madam Speaker, I will.
He will. Representative Frankie.
Thank you, Madam Speaker. Thank you, Chair Marquardt. Is there any proposal in your upcoming tax bill for tax relief for these organizations?
Representative Marquardt.
Madam Speaker, Representative Frankie, you want me to talk about the tax bill right now? I would love to. First of all, a lot of these organizations receive the Paycheck Protection Program. They're going to get up to $34,000 of relief in tax cuts in the tax bill. There are $95 million of county business relief grants going out that specifically mention congressional organized veteran organizations, nonprofits, the whole works. They're going to be able to receive those dollars through those grants. There's property tax relief for businesses and organizations. So I can go on, but there is going to be plenty of tax cuts and aids for these businesses that you are talking about today.
Representative Frankie, not that you asked, but he did give a 20-minute opening statement in 2019, so careful. Representative Frankie.
Thank you, Madam Speaker. Thank you, Chair Marquardt. You kind of bring me to my next talking point that we still haven't passed the PPP. These organizations, these small business owners, they're still waiting. They're still struggling. And now we're talking about this? You know, members, I've heard over the last few days, phrase, one more nail in the coffin. Well, members, if we pass this now and it actually gets enacted into law, it's not one more nail. This is shoveling dirt on the coffin for some of these people. When I was in discussions with the MLBA on this, they said during the shutdown, when some were allowed to be open and others weren't to earn a living, they figured roughly 40% of their membership was surviving off of this supplemental income. Now, hand in hand, our charitable organizations were also struggling because if their partner organizations aren't available to be open, well, then they're not making money either, members. They're not able to provide the services they were able to provide. So once again, we are stuck between a rock and a hard place. Let's get on to the fact of, and I'm just briefly going to mention this because I know there's some talking points going through the Senate and everybody wants to talk about it, but how are we going to pay for the stadium, members? Those decisions still haven't been made. So we're putting the cart before the horse a little bit on a lot of this, members. Let's not talk about the tax revenue generated for the state. Hundreds of millions of dollars, members. I'm going to move on to your own fiscal note here. We had a preliminary fiscal note. Now we have the new fiscal note. I'm just going to read a few captions from this. The board is not aware of any electronic game that exists today that would meet the proposed language requirements. I'm going to read that again. The board is not aware of any electronic game that exists today that would meet the proposed language requirements. So members, this legislation wipes out all current games. Now, I do want to thank Chair Stephenson on his proposal not to enact this until, I believe it's September 2022. But since I've been doing my research on this and talking with everybody involved that I could potentially find in between trying to run my small businesses and do my job here, I've learned to find out that it's about an 18-month process to potentially develop a new game. Then they would have to invest in all new games to potentially earn less revenue. So let's get down to that a little bit here in the fiscal note, members. The board is not aware of any jurisdiction outside of Minnesota that has an electronic pull tab or linked bingo that conforms to the proposed language. So where are we going to go to find it, members? It has to be developed according to this new language. I mean, I'm just stating the facts here, members. We need to slow this down. We need to roll it back. We need to give everybody a voice at the table. I just cannot reiterate that enough. Excuse me. The board cannot also predict whether or not any revenue currently produced from electronic games would go to paper or lawful gambling. However, historically, has not been any correlation between the increase of electronic games or the sale of paper games. So just praying and hoping that people will go back to just playing paper pull tabs, we have no clue, members. I mean, the more I dig into this, there's no answers. There's no answers. How are we going to keep our charitable organizations whole? How are we going to support our communities? How are we going to not be so detrimental to our hospitality industry? And in full disclosure, members, you'll see Frankie's Bar on there. I got nothing to hide. Matter of fact, after I took this mantle up last week, wasn't it amazing that the Gambling Control Board came to my bar on Friday and audited us? Just a little coincidental. Local fiscal impact. Distributors of electronic games will lose revenue, an estimated $12.6 million annually. This is your own fiscal note. Local bars selling electronic games will lose revenue, an estimated $29.25 million annually. Local wages for those conducting lawful gambling will be reduced by an estimated $35.75 million annually. So now everybody who has gotten a job in this industry supporting local charities in your communities is going to be out of work. Well, isn't that just great right now, members? Available funds for lawful charitable purposes will be reduced. So the money that goes back into all of our communities. And once again, members, I am not making this a partisan issue. This is a Minnesota issue. This is every single one of your communities. All those charities, youth hockey associations. This blows my mind, members, that we did not take this more seriously and vet this out more properly, that we could keep everybody whole or at least figure out the path forward. Once again, I'm not here to decide right or wrong, whether the gambling board did their job or we're not holding up to our word. That's not my intent, members. My intent is to stop this bill from potentially becoming law right now without giving everybody a voice at the table with enough time to adjust, or us as a body to figure out how we can do this properly. Available funds for lawful gambling. Once again, back to this, the money that goes back into your communities. An estimated $33 million loss annually. $33 million across the state of Minnesota for your charities. Some of the great charities I listed, our VFWs, our fire departments, our hockey associations, our Lions. I mean, the lists go on and on. You have it there right in front of you, members. At least I hope you do, and if you don't, you should probably look it up and see where your community lies. I don't know, members. I'm just asking and almost begging that we send this back. We do the right thing here for everybody involved, for all parties. Just in the first 6 pages of the list I gave you, over 60 American Legions and over 80 VFWs. I mean, we're all in here. I tried to go through it and kind of pick out some people. And, you know, of course, I went to my own district and how it would impact us. And, of course, my friend Rick Hansen, who shares South St. Paul with me. I don't know if he's aware about the South Robert Streets Business Association, but they're in here a couple of times. And it blows my mind, like, the impact that we could potentially have on them without bringing everybody to the table. You know, what really saddened me, members, when I started to do this research and reach out, so many of these community organizations had no clue this was happening. None. I am still getting calls today from people who are just learning of it. So how are we giving them a voice? How are we talking about keeping them whole? How are we talking about the things that they do for our communities? Members, please help me to understand why we can't send this back, do it right, and get this done so that everybody has a voice at the table. Thank you, members. Please vote green.
Representative Stephenson.
Thank you, Madam Speaker, and thank you, Representative Frankie, for bringing forward this amendment. I mean that sincerely, because there should be a conversation about this. There should be a discussion, and I can hear the passion in your voice that you bring to this topic in representing the interests that you are advancing here and talking about our charities and our bars, who we value. And let me be very clear at the outset, members, something I said in committee and something I will say on the floor here today. The bars have done nothing wrong. The charities have done nothing wrong. This is about what the state hasn't done, which is keep our end of the deal. Going back in time, members, in 2012, as Representative Marquardt alluded to, we decided as a state to build a stadium. And we decided that part of the way we would pay for that is through a tax on e-pull tabs. And that was a controversial idea. And there were a lot of discussions, a lot of people opposed. And we struck a deal with not just the charities, but also our tribal governments in Minnesota, the sovereign tribal governments in Minnesota. There was a deal made, and what I'm asking the chamber to do today is keep that deal. That's what this is about. It isn't about gaming. If you're for or against it, it isn't about the bars and the charities. It's about, are we going to keep our word? It's about trust. Because the games that are being played in establishments all across Minnesota today are not consistent with the deal we struck in 2012. I sent you a video. I sent all members a video, very simple 2-minute video. If you haven't had a chance to watch it, it's in your email box. It really has two components. It first will show you what was contemplated in 2012, what this chamber approved. And then it will show you what is being played today. It's written right into statute. We wrote in 2012, the game shall not mimic slot machines. You watch that video, you watch the games that are being played today, and tell me if we are keeping our word. If we have been good and faithful partners to the deal that we struck in 2012. Now, I understand that this is a difficult issue, again, for groups that did nothing wrong here, and that's why we laid out the enactment date for a long time, to make sure that the bars and restaurants have a chance to recover from what has been an incredibly difficult year that they are still not out of. Absolutely true. And to give game developers an opportunity to develop games that are consistent with the statute, the new rules. And I believe that because of that, that electronic gaming will continue in Minnesota at bars and restaurants, and that charities will get to continue to do the good work that is funded by this, that we will have funding for the stadium, and you don't have to take my word for it. The executive director of Allied Charities testified in the Commerce Committee that that was true, that gaming would continue. Now, I did want to speak very briefly about this issue of process. Just to say that there's a lot of talk about how we were going too fast and speed and shoving this through, and it's really the opposite. It really is, members. This is not a new issue. We did this in 2012. It's been brewing for a long time. This is not the first time that there's been a discussion about this issue ever before. And the reason why we waited to hold a hearing was because we were trying to deal with it at the Gambling Control Board. And it was only after that failed that it came here. And we had a hearing in the Commerce Committee. We had public testimony. We noticed it well in advance. We had public testimony and we took a vote. We did what we were supposed to do under the process. Because it is important. And the MLBA was at that hearing and the Allied Charities was at that hearing. It was a good hearing, a good discussion, and we passed it out of committee on a bipartisan basis. Members, this is a difficult subject, and I understand that. It puts us all in a tough spot, but that's no excuse to go back on our word. We made a deal. We should stick with it. Please vote no.
The member from Goodhue, Representative Haley.
Thank you, Madam Speaker and members. And thank you, Representative Franke. I appreciate your passion and the work that you put into it and all the information that you shared this afternoon on the floor. And I happen to serve on the Commerce Committee, and so heard the bill with Chair Stephenson. And this is to say it's a tough position for us is really an understatement. But I also represent Prairie Island Indian Tribe. They are my friends, they are my neighbors, They're the largest employer in my district. Their success of their business is as important to me as is Red Wing Shoes, Capital Safeties, and every small business owner across my district. When these games, or when this agreement was made in 2012, the technology today for gaming didn't even exist when the agreement was struck. And the tribal communities, the tribal nations, were concerned about it at that time. They were concerned that the technology would quickly move past what we had at that point was paper e-pull tabs. Paper, not paper e-pull tabs, paper pull tabs, right? And so the advocates for the tribal gaming put some parameters in place with the understanding that the insurance was that they would not evolve past how it works when you're doing paper gambling, and that the representations of these games would in fact not mimic slot machines. Well, that is what has happened over time. And the tribal nations have been bringing this issue to the Gambling Control Board, and as Chair Stephenson said, they were not getting them resolved. And so it got kicked back to us in the legislature. What is so difficult about this mission creep, I'll call it, into what is defined as tribal gaming versus gaming at other locations, hasn't been addressed by the administration, by the Gambling Control Board. This is not the fault of any charity. It's not the fault of any bar or restaurant owner. It's not the fault of any tribal nation or any casino. But now it's our job to bring all the parties to the table and try to make the best decision on behalf of everybody. And I would have to agree with Representative Franke that I think this needs more time to reach that right decision. There are so many moving parts, and I believe my colleague, Representative O'Driscoll, is going to speak to those, and so I will allow him to delve into that with a little more detail. But in these cases, when we have competing interests and competing concerns, we do our best work when we figure out the third solution. I believe there's a better solution in there. Some of that might be in Chair Marquardt's bill, but we're not hearing the tax bill today. Right? We've got other pieces that all need to come together on this. This is a difficult decision for me. But as we teach our children, right, you've got to uphold your word, and your word in the legislature, that's what we say, your word means everything. So this is really a balance to holding up the intent of that 2012 law, and in doing so, not harming the other folks that are part of this industry and that receive the benefits of this gaming, all of our wonderful nonprofits that serve our communities. So thank you, member, for allowing me to share those comments, and I think there's other folks that want to speak. Thank you, Madam Speaker.
Representative Jurgens.
Thank you, Madam Speaker. You know, I have some prepared remarks, but I have to go off script a little bit just based on the comments from Chair Stephenson and Representative Haley. I think everybody agrees that this idea, this concept, needs to be vetted more than it has. Let's everybody agree to take the language in the Franke Amendment, which would take this language out of the bill, and let's send it back to committee. Let's talk about it. I'm not on the Commerce Committee. I wish I was, but I don't know what transpired there, but it sounds like there's a lot of people that deserve to be heard. And Chair Stephenson made some good points. Let's have that discussion in committee, and let's get the people that are involved with this, give them the opportunity to come in and listen to them too. You know, we talked many times over the past year about the struggle that many bars and restaurants have had due to the governor's executive orders that closed the businesses completely and allowed for reopening under certain restrictions, and even now to operate with limitations. For some of these owners, they survived the pandemic because of revenue generated by hosting e-pull tabs in their business. When customers returned last summer, in some cases, the profits from e-pull tab revenue was greater than from the sale of food and beverage, which allowed them to keep their doors open and pay their employees and serve their customers. And as important as that is for these businesses, let's set that aside for now, because this is much more than an entertainment option in bars and restaurants. Proceeds from e-pull tabs fund local VFWs, American Legions, charities, youth athletics, nonprofits across the state. Just one athletic association in my district receives hundreds of thousands of dollars from this revenue. And that funding helps keep participation fees low, which allows more kids to participate in the activities. It provides financial aid to kids that have trouble paying the participation fees so that they can. Pays for safety equipment, provides training, used for capital expenses such as bleachers, dugouts, and field upgrades, some of which helps bring tournaments to a city, impacting their economic development. It pays for field maintenance, uniforms, equipment. These are organizations and communities across the state that do these things and much more. Organizations and communities in all 134 House districts, including yours, will be negatively impacted by the loss of revenue to these local organizations. Members, we have a choice today. We can either side with kids, with veterans organizations, with nonprofits in our communities, or we could vote no on the Franke Amendment. I'll be voting yes for kids, yes for veterans, yes for nonprofits, and I urge you to join me. Vote yes on the A26 Franke Amendment. Thank you.
Representative Robbins. Thank you, Madam Speaker, and thank you, members. Thank you, Representative Franke, for bringing this amendment today. I rise in support of the Franke Amendment, and Representative Jurgens said a lot of what I'd planned to say, so I want to just associate myself with his remarks. I do think as a body, the right thing to do is what Representative Jurgens suggested, that we accept the Franke Amendment and go back to the drawing board. As Chair Stephenson said, this was not the fault of restaurants or charities. This was the fault, apparently, I don't serve on the committee, of the Gambling Control Board. And I don't know why they're not doing their jobs, members. I don't know who's supposed to be holding them accountable, but this should not be fixed on the backs of our small businesses, bars, and charities. They have been hammered this year, and they had no idea this was coming. Apparently, this was brought up as an informational hearing on April 12th, which turned into an actual hearing on April 13th. As of yesterday, I still had charities and bars calling me saying, do you know this is going on? What are you doing to stop this? They are blindsided and they are frustrated. They are still not open at 100% capacity. They were closed for a full quarter last spring. Then they were allowed to open at 50% with a lot of restrictions. Then some were closed again. Now we're at 75%, which I get it's a pandemic. Everyone has had to make these accommodations. But to pull this out of the blue on them with no warning, with no ability to participate in the discussion, it's a straw that will break them, many of them. So this will be affecting bars and restaurants in my district and charities. So I counted from the list Representative Franke sent. There are 12 in my community, 12. And I could list them all, but it's the Maple Grove Lions Club, it's the Rogers Youth Hockey Association, it's the Rogers Fireman Relief Association, the Dayton Lions Club. And these charities are all also being hurt by not being able to have all their different community festivals this year. The Rogers Lions has talked with me about all the scholarships they're not able to provide because we had to cancel their big event last year, Rockin' Rogers Days, which is also not scheduled yet now because we don't know what the public outdoor capacity will be for gatherings. These charities are hanging on by a thread and they're missing out on providing the needed support in our communities. But it's also about the bars and restaurants that have been just killed. Malone's in Maple Grove, Maynard's in Rogers, Broadway Pizza, Dayton Bar and Grill. I've got 12 of them. I'm not going to list them all, but that's just in my community. Think of all of the ones in your communities, plus the American Legion and the VFW. So members, I don't know why this was pulled out of the blue. I don't know why the Gambling Control Board wasn't doing their job and managing this appropriately, but this should not be paid for on the backs of our bars and restaurants and our charities. So I urge everyone to adopt the Franke Amendment, let it come out of the bill, and then you can go back to the drawing board and bring everyone to the table. That's the just solution, members, for our communities who are struggling so mightily right now. Thank you.
The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. When I first learned of this, Chair Stephenson called me and said that we have this issue that we're discussing today about the agreement with the tribal nations on the e-poll tabs. And I had talked to Representative Haley about it. And at the time, Representative Haley had said, yes, I had asked for an informational hearing and I had visited with Chair Stephenson. He said, we're probably going to end up taking a vote on this. And as we were kind of getting two different messages that might have been crossing in the night, if you will, on that. I want to make it clear that when we went into the hearing, that there was the plan to take the vote on the bill. But there were a lot of concerns, and it was a very civil discussion in the committee. And I had said that there were two groups that were being harmed by this. One would be the tribal nations, if there was an issue where the state of Minnesota is stepping back on their agreement. And secondly, there would be the groups that made the investment as charities into the equipment, the resources, and making the commitments to their community. And I said, if you vote yes for this, you're keeping one end of the agreement. And if you vote no on this, you're saying that there's another part of the agreement that needs to be fulfilled. And that is the agreement with the people who are the charities. I want to provide some clarity here on another topic, but really quickly, if I could just ask Representative Marquardt a very quick question, if he would yield. And I promise it will be quick. And I do know, by the way, what the definition of quick is on the House floor.
Representative Marquardt, will you yield to a question?
I will, Madam Speaker.
By the way, I really liked your 20-minute speech on the tax bill last year. Representative O'Driscoll.
Madam Speaker, thank you. Representative Chair Marquardt, I really miss sitting on the House floor across from you. You and I used to have some pretty good conversations at the time that we would be at this juncture of the process. But to my question, very quickly, you had said that the local charities and folks were going to be getting some relief. That is going to the business. That is not going to the charities that are being hosted at these facilities. Is that correct?
Representative Marquardt.
Madam Speaker and Representative O'Driscoll, yeah, no, I was talking about the businesses that Representative Franke was referring to. That's correct. And,
okay.
And probably indirectly, maybe, but no, the businesses is what I'm talking about.
Okay.
Representative O'Driscoll.
Thank you, Madam Speaker. So I always want to clarify for members that the American Legion, the VFW, some of these other organizations that would be considered nonprofit organizations may also have a gaming license where they would do gaming and pull tabs and different kinds of things. And then that money would be given to the different groups that you've heard on the floor. And then they also have their business operations. So they may have two different sets of things. The money, as Chair Marquardt said, is not money that's going to the charities themselves for the loss of potential revenue that we're looking at here. Therein lies, ladies and gentlemen of the chamber, the big hole that we're seeing. And that is why you're getting the emails and the communications you are from your districts, because they are going to be gutted from their opportunities to be able to have money to be able to give to the community. I know that in our central Minnesota area, we have one Veterans Club that is actively marketing their location. I understand they're going to be closing, and hearing that there are going to be others in our central Minnesota area. And where Representative Damath is from, where I am from, where Representative Olgamont is from, and where Representative Tice is from. It is extremely important for us to be able to make sure that we address both sides of this. We've potentially solved one problem, maybe. We've also created another problem that's affecting us. And I hope that we would step back and that we would solve both problems at the same time. And a way to do that is to put the brakes, tap the brakes on this, and get around the table and figure out how we're going to do this, because the stadium fund is going to be affected. If you recall, for those of you who have been around here a while, 2023 is the first time that we can refund those bonds. Rates were higher then, rates are lower now. We may want to take advantage of that. The problem that we've got is if we start taking revenue out of there, New York starts getting a little bit skittish at the bonding agencies. That could have a negative impact as well. Lots of things that are rolling on this. So members, please vote yes on the Frankie amendment today. Thank you.
The member from Lyon, Representative Swedzinski.
Thank you, Madam Speaker. Thank you, members. Would Representative Moran yield for a question?
Representative Moran, will you yield to a question? She appears to be unavailable.
Yes,
Oh, she will yield. Representative Swedzinski.
Did she? Yeah. Representative Moran, appreciate the work. Sorry to jump in on this conversation and include you with it. Just a general question. I know there's been some work in the budget and some things have been done with the stadium fund. My belief it was capped. Am I correct in that assumption?
I believe you are correct. I'm sorry, Madam Speaker.
Representative Moran.
What did she say?
Representative Moran, if you can repeat what you said.
Speaker, Madam Speaker, member, that is correct.
Representative Swedzinski.
Thank you, Madam Speaker. Would Representative Moran yield for another question?
Representative Moran, will you yield to another question?
Yes.
She will. Representative Swedzinski.
Representative Moran, thank you for yielding again. What is the effect of that cap on that account? And where does the money go from as a result of that cap?
Representative Moran.
Madam Speaker and Representative, I do not have my notes in front of me, and I would like to be efficient as I can in correct and responding to you. So if you would allow me to get to my notes. I'm not the fiscal analysis, and so I don't have that off my top of my head, but I do want to respond to you. So can you repeat the question again?
Representative Swedzinski.
Thank you, Madam Speaker. And if she's got those numbers, that's great. If not, it's not the most important part. But I do believe this conversation is a much deeper one because of some of the other moves within the budget that was done and how it will generally affect the spending. It's my understanding that capping, because of the robust nature of the expanded game portfolio that's being used across the state, is going to have a dramatic impact on the spending that you've got scheduled by streaming out essentially tens of millions of dollars from the stadium fund to be used in other places within the budget. That should be a concern, folks. That should be a concern. And I think that amendment, in addition to it, could potentially put other spending at risk by essentially cutting off this revenue stream. And, you know, I'm in agreement. I do believe that the Gambling Control Board has not done its job. I believe that these games are out of compliance with that agreement. But I also believe that the majority and the governor, with the decisions they've made within the budget and the essentially scraping out of those funds from the account, are going to have a dramatic effect on spending within the state. And as Representative O'Driscoll mentioned, the effect it's going to have on the bonding prospects of the stadium. So we need to think long and hard on how it's going to affect our businesses, long and hard on how it's going to affect the budget, and long and hard on our gaming facilities within the state, which are an important job creator in rural Minnesota. Thank you.
Further discussion on the Frankie A26 amendment. Representative Frankie.
Thank you, Madam Speaker. Thank you, members. Just going to end on a few things. Thank you, Chair Stephenson, for your discussion today. I appreciate it. You know, let's start with, you know, when I stood up today, I talked about how I didn't want to talk about how we got here, because I think a lot of us weren't here then. Maybe Chair Davids, who knows? Representative Davids. But in speaking with several people who were in the room and who were there seems to be a lot of fuzzy memory from all sides. So that's why, once again, we need to set this back and have these discussions, as far as the discussions I've had about with who was in the room, who wasn't in the room, and which centers. All I know is initially this bill was an Allied Charities bill that was kind of hijacked by the Senate to fund the stadium. And that's what I know. So how do we move forward, members? We move forward by pulling this bill out, pulling this language out, starting back at the beginning, giving all of our charities and small businesses a voice at the table. I was wondering, I just have one more question, if Representative Marquardt would yield.
Representative Marquardt, will you yield to a question?
Madam Speaker, I will.
He will yield. Representative Frankie.
Thank you, Chair Marquardt. Sorry to keep you up today. So I appreciate everything that's in your tax bill coming forward to help our small business and charities, but that's dealing with what everybody has gone through up to date through the pandemic. Would you please help me understand, is there anything currently going forward that would help these charities or small businesses because of the potential loss of revenue and this funding mechanism, should it be enacted into law, specific to this legislation? Chair Marquardt, if you would answer.
Representative Marquardt.
Thank you, Madam Speaker. Representative Frankie, I think everyone's calling on me to keep me from writing my 30-minute opening speech for this year's tax bill. But at any rate, I'm not going to speculate because I don't know what revenue loss would be, but I will quickly say, and you'll hear this tomorrow, is that we have over $1 billion of tax cuts and aids to our families, workers, and small businesses that were hit hardest by COVID-19, and also provides the investment in the future for a lot of things to make the state stronger. So that's about what I can tell you without really going into my 30-minute opening.
Representative Frankie.
Thank you, Chair Marquardt. Thank you, Madam Speaker. So I'm guessing that's a no. That's what I heard, at least, members. Another thing I heard is, yeah, we all understand this is not the faults of our charities or our businesses, but this infrastructure, this funding mechanism for our communities has been built over the last 9+ years. Members, we just cannot do this right now without a proper process. I implore you. And I'm just going to end on this, members, and then I'll be done and ask for your green vote. I did request a roll call, correct, Madam Speaker?
You did. Representative Frankie.
Thank you, Madam Speaker. Well, I will say that come September 2022, that if none of this works out, we know what happens November 2022. Support your charities, your local organizations, and your small businesses. Please vote green.
The clerk will take the roll on the Frankie 826 amendment. Members voting remotely, please vote. Will the clerk please call the names of those members who have not voted yet?
Bo.
Bo votes aye.
Bo, aye. Davids.
Davids votes no.
Davids, no. Hamilton.
Hamilton, aye.
Hamilton, aye. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hausman.
Houseman, no.
Hausman, no. Heinrich.
Heinrich, aye.
Heinrich, aye. Lee.
Lee, no.
Lee, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Rasmussen. Rasmussen, no. Sandell.
Sandell, no.
Sandell, no. Thompson.
Thompson, no.
Thompson, no. Erdahl. Erdahl.
The clerk will close the roll.
Madam Speaker? Madam Speaker?
Representative Hanson, I've closed the roll. There being 59 ayes and 74 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Jurgens moves to amend Senate File number 972, the third engrossment as amended. The amendment is coded A44.
Representative Jurgens.
Thank you, Madam Speaker. Well, had the Frankie amendment passed, I would have pulled this amendment, but what this amendment does is it deals with lessening the restrictions on electronic pull tab sales. With the language in the bill that we just talked about for the last hour or so, it's necessary to look for ways we can work to give our charitable organizations different opportunities to sell as much of the more restricted electronic pull tabs, so they can at least make back a portion of the funding that this legislation takes away from them. I don't think there should be any opposition to this amendment, considering how these newly restricted electronic pull tabs will be mandated if this language passes. This amendment allows placement of electronic pull tabs in sites that don't presently sell paper pull tabs. There are a number of establishments that would like to allow the charities to sponsor electronic pull tabs in their establishment, but they don't want to give up space for a paper pull tab booth. Historic evidence tells us that the paper pull tab sales actually increased with the addition of electronic pull tabs in licensed establishments. So this restriction is no longer needed. I guess that's all I have to say about it, Madam Speaker. It just lessens the restrictions and would allow more establishments to have electronic pull tabs in their locations once they're able to find new games that meet the new requirements if this law passes.
Discussion. Representative Stephenson.
Thank you, Madam Speaker, and members. I'd ask for a no vote. This is a pretty dramatic expansion of gaming in Minnesota. I think this should have been its own bill that gets a hearing and gets talked about. So I'd ask for a no vote.
Further discussion on the A44 amendment. Seeing none, all those in favor of the amendment, please say aye. Aye. Those opposed, please say no.
Aye.
No. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Nash moves to amend Senate File number 972, the third engrossment as amended. The amendment is coded A24.
The member from Carver, Representative Nash.
Thank you, Madam Speaker and members. The A24 would really kind of fix a problem that has materialized because manufacturers of 3-2 beer no longer really make 3-2 beer to sell. This is going to negatively impact a lot of the town team baseball teams that you've seen. And in my district and Representative Bowe's district this summer, the state tournament for town team is going to be held. And this is an amendment that would allow local control to let cities that have already issued 3-2 beer licenses to these town teams and their support associations to also allow them to sell what's called strong beer. And you know, this is a really easy amendment, I think, to do. And I wanted to share one thing with you. I'm a huge baseball fan, and my favorite baseball movie is Field of Dreams, and I want you to think about this as we think about why we should do this amendment. And it says, though the one constant through the years, Ray, has been baseball. America has rolled by like an army of steamrollers. It has been erased like a blackboard, rebuilt and erased again. But baseball has marked the time. This field, this game reminds us of what was good. And that, of course, was Terrence Mann, the character played by but this is a great amendment, and it allows us to say to the town teams, this is important to do. We are watching what's going on. And I want to point out, MLBA has said that the Nash Amendment is not something that they oppose. It allows local control, and it helps us with our baseball tournaments. So, Madam Speaker, with that, I would appreciate your support. And I do believe there is an amendment to the amendment that we can take up.
Representative Greenman, for what purpose do you rise?
Madam Speaker, point of order.
State your point of order.
I rise under Rule 3.21, motions and propositions must be germane, and I have advice.
State your advice.
After reviewing the bill and the amendment, it's clear that A24 is out of order under 3.21. The amendment seeks to amend Minnesota's liquor laws under Chapter 340, and there's no reference to liquor or Chapter 340 in the underlying bill. The amendment introduces a new topic and therefore is not germane.
Madam Speaker, advice?
I've studied the amendment. I have reviewed the bill. I have decided that the amendment is not germane. Representative, and the point of order is well taken. Representative Nash.
Well, Madam Speaker, I think James Earl Jones, who I just remembered, would find that to be sad. But I guess we can just dispense with that and move on to the next amendment since the mind has already been made up.
There is an amendment at the desk. The clerk will report the amendment.
Nash moves to amend Senate File number 972, the third engrossment as amended. The amendment is coded A28.
Representative Nash.
Thank you, Madam Speaker. And while the MLBA may not have opposed my last one, we may have departed from that now. But this is the Drink Local bill that I am pleased to be a co-author on with Representative Olson and many others. I understand that this was not included in the Omnibus bill and there are no chapters of liquor, and I find that to be incredibly disappointing, Chair Stephenson, because you have avoided picking up the mantle of responsibility from the Commerce Committee. You know, the bill is a valid conversation point, and I know that we have put in requests for hearings, and both on this and some that I have authored myself. And we've avoided that conversation. And I was told early on that the Commerce Committee was not going to take up anything controversial. Nothing controversial this year because it's a budget year. However, we have talked about the legalization of marijuana. So apparently marijuana is not as controversial as alcohol. For all you kids watching at home, write that down. Weed, not as controversial as alcohol. That's what we find out. Fast track that through the entire House, wouldn't give alcohol a hearing. So we have been using hashtags like Drink Local, Free the Growler, because we are trying to make sure that the small breweries, wineries, cideries, meaderies, large breweries have the ability to sell what they have to people who would like to buy it without the heavy hand of government saying, no, you don't get to do that. Too much, too far, no. So we have been trying to get those bills heard to offer some relief to those people under those hashtags. Now I know that one of you is going to pop up here and gleefully rule me out of order, but here's the deal. I have dreamt up a hashtag for you guys to use to show the hypocrisy of this, and it's, write this down, Free the Dime Bag. You are more interested in legalizing marijuana than you are in talking about something that already is legal, is providing jobs for thousands of people in the craft beverage industry, and you have decided to make that far less important a conversation than you have marijuana. So apparently you just want to free the dime bag. But members, I would appreciate your support. I would appreciate maybe an overruling of the speaker, because I got a funny feeling that she's going to drop a gavel on me here in a minute. But I'm anxiously awaiting which one of you pops up to rule me out of order.
The member from Hennepin, Representative Edelson.
Madam Speaker, point of order.
State your point of order.
Under motion and propositions under 3.21, there is no liquor provisions on this underlying bill. Chapter 297G or 340A are not in the underlying bill. And I just wanted to say to Representative Nash, I love Field of Dreams too, and Kevin Costner was great. But Madam Chair, this order or this amendment is not germane and should be ruled out of order.
I find the point of order well taken. Representative Nash.
Madam Speaker, I'd like to appeal the ruling of the speaker and ask for a roll call. Again, this is...
Representative Nash, seeing 15 hands, there will be a roll call.
Great.
Representative
Thank you, Madam
Nash.
Speaker. Thank you, Madam Speaker. And Representative Edelson, I kind of figured it was going to be you because you were looking at me. We were making that connection. But members, this is the Commerce Bill, for crying out loud. The Commerce Bill where we should be talking about, things like alcohol, apparently the dime bag, but we should be talking about alcohol issues because this is what the members of that committee and we here in the legislature do. Not hide behind the Senate and not hide behind the trite statement that, oh, well, we don't want to do anything controversial when you're doing weed. So with that, I appreciate your support, members, and I would ask for your vote to overturn the ruling of the speaker.
Discussion. Seeing no discussion, the question before the body is, shall the decision of the speaker stand as a judgment of the House? A yes or a green vote supports the ruling of the speaker. A no or a red vote goes against the ruling of the speaker. Clerk will take the roll. Members voting remotely, please vote. Will the clerk please call the names of those members who have not voted yet?
Backer. Bo, no. Bo, no. Davids.
Davids, no.
Davids, no. Frankie. Hamilton.
Hamilton, no.
Hamilton, no. Hassan.
Hassan, aye.
Hassan, aye. Hausman.
Hausman, aye.
Hausman, aye. Heinrich.
Heinrich, no.
Heinrich, no. Hewitt. Hewitt, aye. Igo, no. Lee.
Lee, aye.
Lee, aye. Mason.
Mason, aye.
Mason, aye. McDonald.
McDonald, no.
McDonald, no. Miller. Miller. New Brindley. Olson B. Olson B, no. Rasmussen. Rasmussen, no. Richardson.
Richardson, aye.
Richardson, aye. Sandell.
Sandell, aye.
Sandell, aye. Thompson. Thompson.
New Brindley votes no.
New Brindley votes no.
Thacker votes no.
Backer, no.
Clerk will close the roll. There being 69 ayes and 62 nays, it is the judgment of the House that the decision of the Speaker shall stand. There is an amendment at the desk. The clerk will report the amendment.
Doubt moves to amend Senate File Number 972, the third engrossment as amended. The amendment is coded A29.
The member for my Santee, Representative Doubt.
Thank you, Madam Speaker, and I would request a roll call on this before I forget.
Representative Doubt requests a roll call. Seeing 15 hands, there will be a roll call. Representative Doubt.
Thank you, Madam Speaker and members. This is an issue we've talked about in the past. It's something that obviously I think the votes exist in the chamber for this to happen. I would guess probably resoundingly. I think we'll find out. But it is something that in the last 12 months has become more of an issue, and I want to talk just a little bit about that. This is the bill that would, or the amendment that would allow beer and wine in food retailers, in convenience stores, gas stations, that sort of thing. We are the very last state in the country to have 3-2. And as I'll tell you here in a few minutes, the beer manufacturers are getting rid of 3-2 beer because of that. There are no other states that now allow 3-2 beer to be sold anywhere. And this is an issue that has grown with the public by more than a 4-to-1 margin, 76% in favor, 18% oppose, according to a recent Survey USA poll. A majority of every demographic and region supported beer and wine in grocery stores and convenience stores in this state. This is a populist issue. This is something your constituents want. Minnesota is one of the few states that restricts beer and wine sales to just liquor stores. And as I said just a moment ago, we're the very last state where 3-2 beer is licensed. Utah, Colorado, Kansas, and Oklahoma eliminated 3-2 beer, and they went for strong beer and or wine in the last, I think just in the last 14 months. Every single state surrounding Minnesota allows grocery stores and convenience stores to sell beer, wine, and or spirits. In fact, 45 states, 45, we're one of only 5 left in the country, 45 states allow the sale of strong beer in grocery stores and convenience stores. 39 states allow the sale of wine in grocery stores and convenience stores. And actually 22, I'm not asking for that in this amendment, but 22 actually allow the sale of spirits in grocery stores as well. This proposal would create a new food retailer liquor license. A food retailer is defined as a supermarket, grocery store, a cooperative, or a convenience store. Retailers would be allowed to sell beer and wine. And this is important, and I want, for those of you that may have been contacted by a city saying, don't support this, this is gonna ruin our municipality. Cities do have the flexibility to issue this license. It is not automatic. And cities with municipal liquor stores can or cannot issue the licenses. They do not have to. They can choose not to. So that's what this amendment does. Minnesota has seen an explosion of new on-sale liquor licenses. Movie theaters, coffee shops, fast food restaurants have all started offering on-sale drinks for sale. There is never any opposition to those in the expansion of on sale, but for some reason, there are proponents always to the off sale. Grocery and convenience stores already sell beer products in their stores. They already sell 3-2 beer, and those products are very quickly going away. And they are used to selling restricted products. They already sell fireworks, tobacco products, lottery tickets, and pseudoephedrine products. So they know what to do. I did pass out, I think virtually pass out. I guess I don't know exactly how that happens. I'm not trying to use props on the House floor, but I'm gonna hold these up so you can at least look for them and you know what they look like. There are a couple of maps. This one shows wine sales in grocery stores. The green are the ones that allow it. This one shows beer sales in grocery stores and convenience stores. Again, the green. Take a look at those. I mean, it's pretty impressive when you think 45 states in the country allow beer sales in their gas stations and grocery stores. And we are on an island here in the Midwest with every single one of our neighbors allowing that. In fact, the closest state on beer is probably Maryland, just to give you an idea of how far we are. I mean, it's not just our neighbors. You got to go halfway across the country to get to a state that doesn't allow beer in a gas station or grocery store. There are letters that have been given to the legislature here and to the state, kind of letting us know that they're going to discontinue selling these products. There are 3 letters that I want to just reference here quickly. One of them from Constellation Brands. They are Corona, Modelo Especial, Pacifico, Victoria, and craft brands from the Ballast Point Brewery. The letter says, and I quote, "Less than 14 months ago, there were 5 states selling 3-2 beer: Colorado, Kansas, Oklahoma, Utah, and Minnesota. As of today, the only state remaining that mandates 3-2 will be sold to through certain retail channels is Minnesota. As a result of this new environment, and as you can imagine, the significant reduction in 3-2 volume, Constellation will cease production of all 3-2 brands and packages effective immediately." This was dated November 26, 2019. This one's dated October 18th, 2019, from Heineken Brands. They are Heineken, De Sicas, Tecate, Amstel Light, Red Stripe, Newcastle Brown Ale, and others. This one says, "Our company has stopped new production of 3-2 beer, period." Molson and Coors. This one's dated March 5th, 2021. They actually have held on and supplied us with some 3-2 for a while, but that ends now after May 31st. So the letter, and I quote, "After May 31st, 2021, it will no longer be economically viable for Molson Coors Beverage Company to place 3-2% beer on shelves in Minnesota. Therefore, Molson Coors will cease production specifically of 3.2% alcohol by volume beer this May." And then the brands that they have, Miller Lite, Coors Light, Blue Moon, and others. So as you can see, the gas stations and convenience stores and grocery stores in Minnesota that are selling 3-2, they currently are selling this product, will no longer have product to sell. And I think it's time that we bring our liquor laws up to current day standards, and I think the expectations of our constituents, and to kind of a more populist position that really serves the consumers and gives them the choice that I think they want in the marketplace. So I would encourage members to support this. The opposition to this really, I think, would have you to believe this is going to hurt their businesses. And the reality is 45 other states in the country are already doing this, including every state around us for more than 1,000 miles. So with that, members, I would strongly encourage a green vote on this. Let's bring our liquor laws up to date and give these retailers some products that they can continue to sell. Thank you.
Discussion to the A29 amendment. Representative Lippert.
Point of order, Madam Speaker.
State your point of order.
Under Rule 3.21, motions and propositions must be germane, and I have advice.
State your advice.
This amendment would make significant changes to the liquor laws under Chapter 340. The amendment would greatly expand the scope of the bill and introduce a new topic. The underlying bill does not address liquor, making the A29 not germane and out of order.
Madam Speaker, point of parliamentary inquiry.
State your point of parliamentary inquiry.
Which bill are we on?
Representative Doubt, we are on the Commerce and Climate and Energy Bill. Representative Doubt.
Thank you, Madam Speaker, and you are right, and a little advice if you'll allow me.
Representative Doubt.
This is the Commerce Committee Omnibus Bill. So it is everything that has to do with the Commerce Committee. And as we learned yesterday, the body does want to take up bills that are in the jurisdiction of committees. If we say that this is out of order and not germane to this bill, it is not germane to any bill. This is where it belongs. This is the Commerce Committee Omnibus Bill that deals with everything related to the Commerce Committee. This bill, when introduced, was referred to the Commerce Committee. It belongs there, it fits in this bill, and I'd ask you to rule the point of order not well taken, and let's take up this bill. We can do that quickly, we can vote quickly, and we can send this over to the Senate.
It is the Commerce Bill, it's not the Liquor Bill. I find the point of order well taken.
Madam Speaker, I'd move to appeal the ruling of the Speaker and request a roll call vote.
Representative Doubt moves to appeal the ruling of the Speaker, requests a roll call. Seeing 15 hands, there will be a roll call. Representative Doubt.
Thank you, Madam Speaker and members. I think you know the drill. This is an opportunity for us to, actually I do have one, if I could ask the chair, Representative Stephenson, to yield for a question.
He will yield. Representative Doubt.
Thank you, Madam Speaker. Representative Stephenson, the Speaker made a good point when she said that this is not the liquor bill. Do you have an intent to bring a liquor bill, or specifically when will you give liquor bills a hearing in your committee? It's my understanding that they have not been given a hearing yet. When will that happen? Do you plan at some point to bring a liquor bill to the House floor?
Representative Stephenson.
Well, thank you, Madam Speaker. Thank you, Leader Doubt. I'm so glad you asked that question of me, because it allows me the opportunity to clear up, I think, some misstatements about what has been going on about liquor in the Commerce Committee. We've had a lot of conversations among members in the Commerce. We've had a lot of conversations with stakeholders, and I have been clear all along that I very much want to see a liquor bill come to the floor of the House for a conversation. We will do that. What I said at the beginning of the year is that we will address first COVID-19 issues, we will address second the budget, and then we will take up issues like liquor. And so I'm looking forward to that conversation, and we will have it, and I'm looking forward to it.
Representative Doubt.
Thank you, Madam Speaker. If he'd just yield for another question.
It looks like he will. Representative Doubt.
Thank you, Madam Speaker. And I appreciate that you're looking forward to that too. I also am looking forward to that, as are many other people, but you are the chair and you're the only one who can tell us when that will happen. And that was my question. I'm hoping you can just tell us, is it over the interim? Is it in the next 2 weeks? Is it next session? I have no idea. I think everybody wants to know what you're thinking. So this is just an opportunity for you to clear that up.
Representative Stephenson.
Well, Madam Speaker, Leader Doubt, I think I thought I just did. I said first we would address COVID-19, then we would address the budget, and then we would look at liquor issues. So I think it'd be great if the Republican members would vote for the bill today, and we could move it along and get a lot closer to getting the budget done.
Representative Doubt.
Thank you, Madam Speaker, and Representative Stephenson. Obviously you're not answering the question. You don't want to, that's okay. But you said that we were going to deal with the COVID stuff first, then we were going to deal with the budget stuff, and then when we're done with that, we're going to deal with the liquor stuff, which, by the way, liquor stuff is legal in the state of Minnesota right now. You did in your committee have a hearing on marijuana. So how do you justify having a hearing on marijuana when you said your committee was going to have hearings on COVID and on the budget first, and I thought we hadn't got to other things. We're not done with the budget yet. That's what this bill is. How did we fit marijuana in there and we haven't had a liquor hearing, if he'll yield?
Representative Doubt requests Representative Stephenson to yield. He will. Representative Stephenson.
Well, thank you, Madam Speaker, and Leader Doubt. And, I do care a lot about issues related to liquor. I do care about our craft brewers. I'm very fond of them, and I appreciate the analogy that you're trying to draw between that issue and the cannabis issue that Representative Nash and others have. And I don't say this at all to diminish the importance of the liquor issue, which I think is very important, but let's be clear, no one right now is going to jail for selling a growler. And we are not concerned about disparities in how policing of micro distillers that are white versus micro distillers that are people of color. The cannabis issue is a very important issue for a host of different reasons. There aren't veterans in the state who are suffering with PTSD or children who have diseases who can't get the medication that they need to alleviate their pain and suffering because of what we have on the books today on cannabis. And so that's why we had a hearing on cannabis, because it's a very important issue that a lot of people want us to address and has far-ranging consequences.
Representative Dowd.
Thank you, Madam Speaker and members. To debate the question before the body, obviously, I'd request that you overrule the Speaker and we take this bill up. I asked 2 or 3 times now, the chair, and literally can't get an answer. I mean, I'd be okay with just you saying, you know, yeah, we're going to try to do it before the end of the session. We're going to do it over the interim. We probably won't get to it till next session. Nothing. I can't get anything on that. These businesses are going to lose this product, and consumers are going to lose this option. We're not talking about something extra. They are. 3-2 beers going away. You want the letters? I can pass them out. If I had, I could.
Parliamentary inquiry, Madam Speaker.
Representative Winkler.
Madam Speaker, I did not want to interrupt the conversation about cannabis, but I do want you to inform us what issue is before the body right now.
It's the appeal of the ruling of the Speaker on whether the doubt amendment is germane or not germane to this bill. Representative Dowd.
Thank you, Madam Speaker. And if you want, Representative Winkler, I don't have a page here, but I'll walk them over to you when I'm not speaking, the letters from the manufacturers. These products are coming off the shelves. We don't have time to wait for a hearing that we don't know when it's going to be. This absolutely is germane to this bill. This is the Commerce Omnibus bill. Everything related to commerce is germane to this bill by definition. It absolutely is. If you don't want to vote on it, vote no. But this is what happens when just a couple of people with a little power decide, nope, we're not going to let anything go through. Just let the body vote. Out of order, out of order, out of order. Not out of order. This is the Commerce Omnibus bill. Where shall I bring amendments that are commerce related? They go on the Commerce Omnibus bill. On the next bill, you are going to rule that a gun amendment is germane to that bill, and then you are going to rule every other gun amendment not germane to that bill. You don't get to pick and choose. This is the Commerce Omnibus bill. If it's not, then call it something else, but that's what it is. It's what you've called it the entire time to get it here. And now commerce-related issues aren't germane to the Commerce Omnibus bill. And I guarantee you, members, that your constituents want to buy full-strength beer in their gas stations and grocery stores like they can do in 45 other states. It's time to change this. It's time to give our constituents what they want and what they need. And this is your opportunity. We pass this opportunity, there isn't another one. The final omnibus bill, when it comes back, will not be amendable. It'll be a conference committee report. And we can't put this in. And apparently the chair is not having hearings on liquor bills. And I can make that assessment because I asked him 3 times and he couldn't tell me that he was. So we have to assume that he's not. This is a real issue. Your constituents want it. Let's give the people what they want. Think about that. This is your opportunity. Vote red.
The clerk will take Representative Winkler.
Madam Speaker, I just want to set the record straight for the body about the standard for germaneness, which is that a motion for an amendment has to be germane to the bill, and it is upon the burden rests on the person who is making the motion to establish germaneness. And just because a bill is an omnibus bill doesn't mean that every topic related to that bill is germane. That is not the standard. If you have another bill that this amendment could be germane to that comes to the floor, you could offer it. There are multiple ways you can use the process to try to get a hearing or a bill voted on. But just because it's an omnibus bill does not mean that every topic related to it is germane. That is not how germaneness works.
Representative Dowd, Madam Speaker would work better. Representative Dowd.
Well, I have been up there and I know how easy it is to not see someone, so I just wanted to ensure that you might see that I'm standing. And Representative Winkler, I have in the past understood that to be the standard as well. However, yesterday in this chamber, this speaker was a little unsure on a question just like this one, so she put it to the body. And the body set the standard that a bill with jurisdiction in that committee was germane to an omnibus bill. It happened on this floor yesterday, and this body made that decision. So we don't get to change the definitions of these things. This is the Commerce Omnibus Bill. Your constituents want this. This is your opportunity to give it to them. And I guarantee you they'll be paying attention. A red vote will give the people what they want. Let's give it to them.
The clerk will take the roll on the appeal ruling of the speaker. A green or a yes vote sides with the speaker. A no or a red vote is finding against the speaker's ruling. Members voting remotely, please vote. Will the clerk call the names of those members who have not voted yet?
Backer.
Thacker, no.
Backer, no. Bo.
Bo, no.
Bo, no. Davids.
Davids votes no.
Davids, no. Frankie. Frankie, no. Hamilton.
Hamilton, no.
Hamilton, no. Hassan.
Hassan, yes.
Hassan, aye. Houseman.
Houseman, aye.
Houseman, aye. Heinrich.
Heinrich, no.
Heinrich, no. Lee.
Lee, aye.
Lee, aye. Mason.
Aye.
Mason, aye. McDonald.
McDonald, no.
McDonald, no. New Brindley.
New Brindley, no.
New Brindley, no. Rasmussen. Rasmussen, no. Tice. Tice, no. Thompson. Thompson.
The clerk will close the roll. There being 69 ayes and 64 nays, it is the judgment of the House that the decision of the Speaker shall stand.